Hi everyone, William Quang here from the Adelaide Hill Pain Clinic and SA Running Injury Clinic. Now, today's topic, we're going to talk to a gentleman who runs a practice Daniel Fitzpatrick. He's a podiatrist from Sydney, but he doesn't do, I guess, traditional podiatry. Most traditional podiatry revolves around a lot of it, when it comes to musculoskeletal podiatry, it's around orthotics, and Daniel doesn't do that. What he does is like chiropractic for the foot, like mobilization, manipulation of the foot and ankle joints. So it's a little bit different, but it has some really, really great results. So if you have anyone who, struggles to wear the orthotics, struggles to fit them inside their shoes, or they just haven't had great success, then Daniel's techniques really can provide an alternative option. So I'll let Dan introduce himself, and we'll talk about how he fixes his feet.
Hi everyone, good morning to everyone in Adelaide. I believe it's just good morning. So my name's Daniel Fitzpatrick. I own Alternative Foot Solutions, and we have a couple of clinics here in Sydney where we specialise in foot mobilisation therapy. Once upon a time, I used to do lots and lots of orthotics myself. And I still am a big believer in orthotic therapy, but we just probably cater to people who may not want to wear orthotics for whatever reason. And there's a few different reasons for that, which I'm sure we'll discuss today. And I guess we've specialised in foot mobilisation mainly through sheer demand, just because not a lot of other podiatrists are doing this type of work. I'm really keen to discuss the topic today. And I know at least one of your team members is definitely doing a lot more foot mobilisation these days, I believe.
We've got three actually who've done the level 2 course. So awesome. So we've got Jason, Bridget, and Gemma who've done it. I haven't actually done it because actually the last time the course was around, which only happens once a year in Adelaide, I actually went. We met at that conference. Actually, it was in April. So I was at that conference. So I had to go to that conference, and I sent the other three to the foot mobilisation course. So yeah. So those three do it, and we're getting great results with it.
I must confess, whenever we think are indicated, we put her on.
Sorry, we lost you there for a second, Dan.
All right.
Could you repeat? You just went offline for about 20 seconds.
I was just saying how great it is that now that your practice, now that you've been doing it a while, that it sounds like as if your practice has all bases covered. Now that you offer the orthotic therapy, shockwave, and also foot mobilisation, there's not. I imagine they're wonderful tools to cater to all of your patients' needs.
Yeah, and as we said, there's some patients that don't want to have an insert inside the shoes. A lot of the ladies prefer to have shoes which can't cater for them, and I think that's probably the group of people that really come in and see your three. Is it three podiatrists that you have?
Yes. Yep. 3 pods plus myself. Yeah.
Yeah, so that's where I guess we can help everyone rather than just people who can fit an orthotic in. So
I suppose it all comes down to the needs of the patient, really, doesn't it? So
yeah, it's different. Yeah. All right. So we were talking about yesterday. I guess the two major injuries, and obviously we have one major injury, but you have two major injuries that you see in your clinic, and that's your pain and arthritis in the big toes or bunions in the big toe.
Yes. Yep. Now, I must admit, bunions probably makes up about 60 to 65% of our patient load now. It's not that I deliberately wanted to get into bunions, but the reality is that 1 in 3 Australians has a bunion. And the only other option apart from foot mobilisation is surgery. Now, as you can imagine, surgery is a pretty scary option for a lot of people. And in some cases, surgery is indicated, definitely, but you can imagine how a lot of people would be very motivated to consider a conservative management approach like a gentle hands-on technique where we can actually correct that level of alignment to a degree. So as a result, the bunion side of our practice has probably exploded. And I mean, we've been in existence for about 10 years now. And I know particularly probably in the last 7 to 8 years, it's really taken off. So yeah, it's pretty ginormous in that respect. And as you say, the other big thing is heel pain. And that's just simply because, as you know, heel pain is such an enormous topic that just has such high rates in the population. And I guess you guys know that more than I do, considering the nature of your clinic.
Yeah, well, it's funny you say that because right at this moment, Bridget is with a bunion patient. And it's funny, we get patients and then the patient says, oh, my bunion's hurting, or they're really concerned with the bunion. And that person was a heel pain patient that we fixed.
Yep.
And now it's just a case of, oh, can you fix this thing as well? So it's great. We've got the other avenue, actually being able to do the foot mobilization. So doing both, I guess, both your strengths.
Yeah, how fantastic that you can offer that to your patients. And I mean, I guess it makes sense when you look at the basis of why you get heel pain and then why you get a bunion. They're pretty similar, aren't they? Or there's some significant similarities there. So
just see that people wear can inflict those two injuries on that person. Yeah. So yeah, that's great. So essentially, people are probably going to wonder what actually do we do, or what do you do? So I did mention it's a bit like.
Yeah, great question. And I think it's always great to get that information out there about foot mobilisation, because sometimes people think you're a little bit of a witch doctor because not a lot of podiatrists are doing this necessarily, or it's not considered mainstream. And the reality is that foot mobilisation has been around in one form or another probably since the mid-70s. And what we're actually doing is it's just a very gentle hands-on technique where we work on correcting the level of alignment within people's joints, and then we actually give them exercise to support those changes. Now, foot mobilisation takes a little bit longer than an orthotic to sort of get results, but the upside is that the changes tend to be long-term because you're reinforcing that position with positive exercises. That help reinforce that position of the joint that you're trying to change. So the actual treatment itself doesn't really hurt. The actual mobilisations are really quite quick, and they're very painless for a reason, in that you get a much better result because someone's nervous system doesn't fight you every time they come in and see you.
Yeah, and I think one of the other things is lots of people who come in for bunions are actually more concerned about the cosmetic look. And from what we've discussed in our meetings about the foot mobilisation, it does actually get the toe a little bit straighter, doesn't it?
Yes, very much so. And I think the important point that we always try and clarify with people is that you can actually straighten the toe, and by doing that, you do reduce the bump to a degree. However, if the bump is significant enough, sometimes you can't get rid of the bump completely. And for that, we refer on to the surgeon if people want that enough. But even now, we're finding I don't know about Adelaide, but I know in Sydney, most of the really good surgeons are very reluctant to operate on bunions these days unless there is a significant level of discomfort. I mean, I think the classic line by probably one of the top guys in our area is, "Come back and see me when you can't walk," because bunion surgery is significant and it's fairly traumatic, and a lot of the really good surgeons won't do it lightly.
Yeah, it's definitely a couple of months where the patient's in pain. So yeah.
Yes. Yeah.
Daniel, do you have any other things that you had to add before we wrap things up?
Yeah, I'd probably say that I just think it's I think that probably the takeaway is that I don't think orthotic versus foot mobilisation are mutually exclusive either. I think the great thing about foot mobilisation is it can actually, if you wanted to go down the road of orthotics, you can actually use foot mobilisation to improve the way the orthotic works or make you less reliant on the orthotic. I think both therapies work really well together. And I know we see that regularly by having a really good relationship with other podiatrists in our area. So, yeah, I think it's wonderful that your team has all of those skills and can offer the best possible service to your patient load.
Great. All right. Well, that's great, Dan. So what we'll do now is we might have to wrap it up because I've got a meeting to get to. But thank you for your time. Thank you for your time. Now, if any of your patients or any of Daniel's patients have any questions just regarding this, just write it down below in the comments below. If you want to tag a friend, feel free to do it. And yeah, like and share it. If people in Sydney want to see Daniel, where are you located, Daniel?
So we're located in the CBD in Harrington Street and in Manly.
Okay, yeah, so quite central positions. All right, well, thanks for your time, Daniel. We should do this again.
Thanks very much, everyone.
All right, we'll see you soon. Thanks.
See you later.
Bye.
Bye.